So I'm making this video because I experienced a rare type of heart attack a few days ago. I strongly feel like a lot of people should be prepared for something like this because it is possible to happen in anyone at any age. Some things that I wish I would have known, that I could have been prepared for myself, that I was not. Everyone's different now. If you ever experience anything like this yourself, which I hope you don't because it's extremely scary, but of course, your own symptoms and signs may be different. This is just what I experienced. That I had shortness of breath. I felt exerted just from doing nothing. I was just sitting in the car driving actually, and I noticed that I was needing to deeply inhale and do stomach breathing more often. So it kind of started increasing throughout the afternoon. I noticed I was having some chest pains, kind of minor, but they were like sharp shooting pains, kind of in the middle towards the left area. Sometimes I don't know when it's serious enough. So I called the nurse hotline. I told them what I was experiencing, and I was told to go to the doctor and get checked out. And so I got to the doctor immediately. Luckily, I was able to get in within that next hour. And I asked someone to drive me because I could tell, like, my gut was telling me that I needed someone to drive, that I wasn't okay to drive. And at this point, it was becoming a little bit harder to breathe. It wasn't anything scary, but I noticed that it was becoming harder to breathe. I felt like my inhale was limited. So I go to the doctor, and I'm sitting there in the office, and I noticed that it's like really, really hard to breathe now. My breathing was like exasperated. I'm still dealing with a little bit of it right now. It's not totally gone, which is normal. In some cases, I guess. I wouldn't say normal, but it can be something that you experience. Luckily, I had an amazing provider. They got my symptoms, they examined me, they hooked me up to an EKG or ECG right away, echocardiogram. And they ran scans of my heart, and while I was lying down, the shortness of breath increased. My chest was very tight. There was a lot of pressure. They were trying to speak to me and ask me questions, and I couldn't speak right. My words weren't coming out right. My head was kind of foggy. I was getting a lot of... The pain in my chest had increased, and it had also spread down my arm. And my hands became very, very clammy. There's a lot of pressure in my head and ears. I knew at that point that something wasn't right, and the doctor told me, hey, I can call an ambulance for you, or, you know, it's around the corner, so you can go there yourself. You need to do something about this now. Luckily, it was not even a minute away, so I could avoid an ambulance bill, because those are not fun. I got to the ER. But at this point, I'm reaching my I don't know why, but my hand just like reached out. I'm gasping. I'm like searching for help or searching for air. It's just what my body did. And I'm like, just kind of, I could barely walk. I walked up and I tried to tell them what I was there for. And I told them as I'm gasping, I can't breathe. I have chest pains and tightness. Is there something I can get to help me breathe? And I was like, I can't breathe, you know, just barely able to talk. It was a very scary experience because of my age. I would assume that they had only thought it was just an anxiety attack or something, which was really unfortunate because it was very scary, and I felt very helpless. I was around people, and I was falling into the walls, trying to go outside to get some fresh air, just trying to catch my breath and breathe, and I couldn't, and I wasn't getting help. And I had asked 2 people at least if they had something I could use to breathe, and no one could give me anything. I remember going outside feeling like I needed fresh air, and I fell up against the brick wall, and I'm gasping. Finally, the person I was with, they came inside with me, and security noticed that I couldn't really walk. I couldn't walk right, so they gave me a wheelchair. And as I'm sitting, that was the point of which it got the absolute worst. I'm sitting in the chair and I grabbed a plastic vomit bag because it's all I could have around me that I thought might help me breathe as much as I could, at least in that moment. Trying to breathe with this plastic bag, and I began to tear up because I could not breathe. I felt like I was suffocating. I never experienced anything like that before. It lasted quite a while. I would say it definitely went on for about an hour. My symptoms were at least about 2 hours. I mean, the moment where I really could not breathe was like, I really felt like I was suffocating. It was that extreme for, I don't know, maybe a few minutes. Everything was it was intense. It was very intense. The moment where it was at the prime, like, peak of it, it felt like a long time. Although those symptoms did last quite a while. Afterwards, I was waiting in the waiting room for about 2 hours, give or take. So by the time they took me back and got the second ECG, my heart had already calmed down. Luckily, the first ECG showed that they caught me in mid-turbulence, so they caught it. And the second time, my heart had already calmed down, but my pulse was still pretty fast. I just felt so exhausted. I kind of just fell over to the side in the chair. And my muscles also, that was another thing. My muscles were like they were like contracting in my whole body. I was having like muscle aches, and that lasted for a while. I sat, I felt weak. I felt very weak and fatigued. Anything I did nothing at all, and I was exerted. I just want to share this because if you're someone like me who kind of, I don't like to say downplays symptoms or sicknesses, but feels like you're invincible sometimes, and you don't have someone around you like I do who's reminding me to take care of myself and to go to the doctor and get checked out. Just, if something's not right and it's not comfortable, get it checked out if you can. Do whatever you usually do. I'm not telling you to go to the doctor, but if something's not okay, try to get help for it, however you would get help for it. I am not I'm not in the clear yet. I'm speaking healing over myself and the blood of Jesus over my body, because I called out to him in that moment, and I said, I know you're with me, and I know I'm gonna be okay. And that gave me immediate comfort. But I'm still in the midst of dealing with, taking more time to speak right. There's some stuff I'm working through with that again. Feeling winded, the shortness of breath. I still have some chest pains going on, and I need to see a cardiologist. So, when you have something like this, regardless of the age, you can be prone to it happening again, or even cardiac arrest. So it's a very serious thing. And I've been dealing with some flashbacks. I think afterwards, waking up and knowing what I experienced was the scariest part, because that's when it really hit me that as young as I am, I experienced something that scary. And I've been through a lot of different scary experiences in my life, but I'm so grateful that once again, God saved my life. I'm here for a reason, and I want to share what I've been through, enlighten other people, and prepare them. So hopefully you know what to prepare for or expect if you ever have those symptoms. Like I said, I hope you don't. But again, like, if you notice anyone ever around you that seems like they're struggling and they need help, please ask them if they're okay. and with the person's permission, ask if you can call 911, because sometimes you need to do that. Not suggesting you do anything specific anyways, I'm just clarifying that. I just had to share what I went through in hopes that maybe there's some kind of information that might help someone else. I'm gonna try to do an update video when I have some other answers that I need clarity on. And if things go that route, then I will probably be making a follow-up video, just sharing how I'm doing at that point, and some other information. Thanks for taking the time to watch this.